Good day and welcome to this Huntington Learning Center webinar. What every parent should know about IEPs and 504 plans for ADHD. Tonight's presentation comes to us from Dr. Mary Rooney, and we're always very happy to have Dr. Rooney present because she is one of the foremost experts in IEPs and 504 plans, and she's done a lot of great support for us in the past. So I'm Michael Hackmer, be your moderator for today's event. And on behalf of Huntington Learning Center, I want to say thank you for making time to join us this evening. We know that there's a lot going on, so we certainly appreciate you making time to join us for this presentation. So a little background on Huntington Learning Center. For those of you who are aware, some of you may not be aware, but Huntington has been around for about 50 years, and we're a proven tutoring and test prep organization serving students in grades K through 12. There are three things that I think really help differentiate Huntington from other tutoring and test prep centers, or just going out and hiring a tutor or someone to help your child. And here's what they are. First and foremost, highly trained, certified tutors. Everybody that interfaces with your child at Huntington has gone through a training process as part of our training team, and they're skilled and able to work with your child across a variety of different subject matters and issues. So it's really important for all of us at Huntington that your child has the best possible experience. And so that's why we really focus on the training and certification of everyone that works with our students. The second is our accreditation. So we're accredited by Middle States Association of Colleges and Schools. And the reason why that's important is that as your child goes through their degree and certification and other kinds of academic programs, and especially in higher education, a lot of those schools are all going to be certified, or accredited, I should say, by Middle States Association of Colleges. So for us, it's really an important accreditation. We like to maintain that kind of consistency in terms of our academic standards. And third, but I think probably the most important, and I certainly think probably one of the best differentiators with Huntington, is that everything we do is individualized or personalized. All of our academic programs, everything we do, whether it's our ADHD or our studying or our test prep, particularly for college exams, right? Everything we want to do, we want to get in, get your student in, do an assessment, figure out what the strengths and weaknesses are, because while everyone can say, yes, I struggle maybe a little bit with math, or yes, I have some issues in studying or test taking, at the end of the day, every child is a little bit unique, and we want to make sure that we identify what those things are so that we're working towards fixing or resolving, working with your student on the things that they're probably having the most challenges with. And I think the results ultimately do speak for themselves, as you can see on the screen, right? If you're looking at test scores, SAT and ACT. On the SAT, you're looking at an average increase after about, I think about a 3-month program, about 229 points and 5.4 points on the SAT. And then also within the 3 months, we also see a significant increase in reading levels and in math levels and skills. And that's really important for all of us at Huntington, is to make sure that, you know, over that period of time, you're seeing that kind of progress. And also available, as you can see on the screen, we have a lot of flexible options too, because we know that not everybody can get into a center every day, right? And so we want to make sure that we have flexible scheduling options, as well as both in-center and online options for your student. So our speaker today is Dr. Mary Rooney. Dr. Rooney is a licensed clinical psychologist, board certified in child and adolescent psychology. She is a nationally recognized ADHD expert. In fact, she writes frequently for our ADHD blog on Huntington, and has been to a lot of different webinars and spoken not just on ADHD, but also on IEPs and 504 plans. And so we're really very fortunate to have her and her expertise with us tonight as we go through this really important topic. So as I mentioned, there's a couple of things that we wanted to go over before we turn things over to Dr. Rooney. So the first is our Huntington Foundational Programs. So we have our Learning Center and our Exam Prep, and a lot of folks are very familiar with the Exam Prep, but the Learning Center I think is really important and really ties into a lot of what we're going to talk about potentially tonight. And it's an academic and skills-based program that's really customized to meet student needs. We cover everything from K through 12 tutoring to subject-specific material like science, to your reading, your writing, your spelling, your phonics, as well as our ADHD program which we think has been very successful in helping students over the course of their schooling. And then, of course, the exam prep, I won't spend a lot of time, but as you can see here, if you have a student that is looking at taking either college, preparatory exams or college admissions exams, all the way through to the secondary school exams and your AEP exams, Huntington is well-versed in all of these exams, the changing formats that many of these exams are going through. So if you're looking for more information on that, please let us know. We'd be happy to help you out. And then, of course, I mentioned a little bit ago about the idea of an academic assessment and sort of the concept of the academic evaluation. So what is that exactly, though? So this is where we have a student come in, conduct a test, and that's really designed to allow us to pinpoint the exact needs. As I mentioned before, a lot of students have very similar strengths and weaknesses, but at the end of the day, every student has their own specific strengths and weaknesses, and we really want to concentrate on where we can help out the most. And so the goal of every academic evaluation that we do is to really help us understand those strengths and weaknesses and then develop the best possible program that's very personalized and individualized to your student. And then we have the Huntington Advantage program. And so you can see on your screen, so the description, some of the options, right? We have a very nice, diverse audience tonight, elementary, middle school, and high school, right? And so a lot of what we do with elementary school students is to build and reinforce a lot of those skills that your child is going to need as they go through their academic journey, particularly as they get through elementary school and into middle school, reading, writing, phonics, study skills, building those basic skills so they become really second nature, because it's really important to establish those good habits and those good skills at a very early age. In middle school, we work to help kids who maybe have gotten off track or maybe are struggling with some of the more advanced work that goes on in middle school, to really help them better meet the demands of their teachers and their classroom curriculum, but also help them get more prepared for that transition to high school. And then, of course, when you're in high school, there's a lot of customized programs. And then, of course, as I mentioned before, a lot of the college admissions exams, the SAT and the ACT prep, which are really, really critical and very, very competitive. So we want to make sure that you do as well as those as possible. So as I mentioned before, right, the results do speak for themselves. Students who do complete the Huntington test prep, see a lot of advancement on their scores in the ACT and the SAT. And then, of course, we work through all the different kinds of test taking strategies and really just try to make sure that we're as flexible as possible so that you can get the work in and maximize the benefit of spending time with people who have really studied and understand these tests and really can work with your student to improve their overall performance. Dr. Rooney, I'm going to turn it over to you so you can go through our agenda tonight.
Wonderful. Thank you, Michael. And welcome, everyone. I'm so glad you are all able to join us this evening. Today's webinar is all about helping you understand the educational supports that are available for children and teens with ADHD, specifically IEPs and 504 plans. Whether your child's just been diagnosed or you've been on this journey for a while, understanding your rights and options can really make a world of difference for you and for your child. So today's agenda will cover the impact of ADHD on learning, just kind of a broad overview of that, IEPs versus 504 plans and understanding the difference between those two, some common accommodations and services and interventions for students with ADHD, IEP process and some strategies around navigating that, and then some case examples, and then some strategies you can use to advocate for your child. And then I'll put a few online resources up there and we'll go through a Q&A. So starting with ADHD and school challenges, I think, as many of you will know, having children with ADHD, that ADHD affects much more than just attention, right? So kids and teens with ADHD typically struggle with following multi-step instructions, completing their work on time, staying seated or focused, following rules in the classroom. Those can be some big rules with some big behaviors, or even just smaller rules, right? Like raising their hand before they speak, or not talking, or getting up quickly and getting in line with other kids. Managing their emotions and frustrations, transitioning between activities, staying organized, and all of these really fall under the bigger umbrella of executive functioning, right? And executive functioning really is anything that's related to being able to kind of have that self-control over your attention, actions, and basically emotional regulation. So while ADHD is a medical diagnosis that impacts all areas of a child's life, when you're thinking about school services and IEPs and 504 plans, as a parent, when you're working with a school, you need to focus specifically on how it impacts your child's educational performance, right? But this includes not only impact on their grades, but also the impact on their ability to function well in the classroom and just meet all of those demands and requirements that come with being a student. And so we'll be talking more about that today. So starting with a big overview, we'll talk about what are IEP and 504 plans. So school services for ADHD, broadly speaking, are often implemented through IEPs, individualized education programs, or 504 plans, and we'll be focusing on these two formal mechanisms today. Before I dive into those, I also want to note that many students with ADHD receive informal services at school without an IEP or a 504 plan. So it's not uncommon for teachers to use things like a structured behavior plan in the classroom that's tailored to meet the needs of a specific student with ADHD, or for them to put additional supports and accommodations in place that make it more feasible for a student with ADHD to complete their classwork or homework. And these interventions and supports and accommodations might not be documented in an IEP or 504 plan, but they typically happen because there's a strong teacher who proactively implements them in the classroom and then works closely with the parent, the child's parent, to kind of figure out what works best for that student. So the benefit of IEPs and 504 plans is that they're legally binding documents that obligate schools to provide specific accommodations to students with ADHD or other disabilities. And with them, you're not as dependent on getting a quote unquote good teacher that year who kind of has that initiative and drive and bandwidth to do this independently. They become mandated to do it. And if they can't do it successfully, then the school needs to take some remediation steps for that. So, talking about IEPs and 504 plans, they are similar in that they both require the school district to provide students with a free and appropriate public education, right, that they can access and allows them to access the curriculum or the traditional curriculum in the classroom. And if that can't be done, then the curriculum needs to be adapted or modified with specialized instruction. Both IEPs and 504 plans contain individualized information about the accommodations and related services that the students receive. And for both, a formal evaluation is followed to determine whether or not a student is eligible. Although in some districts, this evaluation process may be different for an IEP and a 504 plan. The differences between the two at a kind of granular level, there's a different legal basis behind each of them. So the IEP, Individualized Education Program, falls under the Individuals with Disabilities Education Act, or IDEA. And most legal protections for the IEP are clearly defined in the law statute. So they're in the actual written law. So they're very difficult to change. These laws have been around for many years and have remained unchanged. The 504 plan falls under the Section 504 of the Rehabilitation Act and is governed by the Act's regulations, which are these standards that are adopted by administrative agencies. And the regulations are a bit more flexible, and they undergo periodic updates that might impact how 504 plans are implemented. IEPs come with a federal funding component, requiring schools to account for the number and nature of IEPs that they provide, and the federal government kicks in a percentage of funding for the services that are provided under IEPs. I think like somewhere between 15 and 20%. IEPs also typically are more resource intensive and more costly for schools to implement. So some schools see 504 plans as a more streamlined and efficient way to provide support to students who need accommodations, but don't need some of the more intensive interventions that are often included in IEPs. So broadly speaking, IEPs are for students who require specialized instruction or specific interventions. Just as an example, like for a student with ADHD who may be below grade level in reading because of difficulties with processing speed or reading comprehension, an IEP might include specialized instruction in the form of small group pullouts for reading, right? Or an ADHD student might have social skills groups that they get, or individualized behavior plans in the classroom. In contrast, 504 plans primarily cover accommodations to ensure that the student can access the curriculum. So an example of an accommodation might be reduced homework assignment. So I'm thinking very simply about math worksheet assignment. Instead of having to do 3 pages of the math worksheet in the evening, which is taking the student an hour to complete, they only have to do one page of math problems, which takes them maybe 20 minutes to complete, which is more in line with the time spent on homework expectation for that grade in that classroom. So let's go through some of the specific features of an IEP. So as I mentioned, they provide specialized instruction and related services for students with disabilities who require it to access and progress in the general education curriculum. So some of those specialized instructions was what I was talking about previously, with maybe small group pullouts, but it can also be more intensive behavior plans in the classroom that are focused on specific goals that can be related to organization, staying on task, and also behavior. They're governed by the Individuals with Disability Act. And to be eligible, students must be identified as having a disability, of which ADHD is one, that adversely affects their educational performance and requires specifically designed instruction. The components of an IEP, and this is a key difference here from a 504, is that an IEP includes measurable annual goals. So in addition to having a specific intervention named, or an accommodation named, or a support named in that IEP, there will also be a goal with it. And so if for a kid who's behind in reading, that measurable goal, may be to progress in their reading fluency by a certain percentage by the mid-year point, and then another percentage by the end point, or progress in their, become progressively closer to being at grade level with reading. For students where it's more behavioral, it can be something like a decrease in the number of kind of problem behaviors that are seen in the classroom, or improvement tracked on the behavior plan in terms of things like time spent on task, or even number of homework assignments turned in, percentage of completed homework assignments. Those kinds of things can be goals as well. And so those are tracked and measured 2 to 3 times per year in an IEP, and is an important part of it. So it includes measurable goals in the IEP. It includes the description of the specifically designed instructions or interventions, and it also includes related services that a student might need, like speech therapy or occupational therapy, as well as accommodations. When IEPs are implemented, they're developed by a team that includes parents, teachers, and specialists at the school, and they're reviewed in a meeting at least once a year. You'll get IEP reports more often, like 2 to 3 times a year, but the review occurs in a meeting format once a year. So for a 504 plan, it's individualized, and it details the accommodation, supports, or services that help the student learn effectively. The goal is really to remove barriers to learning and create an inclusive environment rather than providing specialized instruction. And sometimes it's easier, I think, to think of these like removing barriers to learning when you think more about a very specific impairment. Like if somebody has a visual impairment, they can have 504 for visual impairment. And they're not necessarily going to have specialized instruction, but an accommodation that would allow them to access the curriculum and remove barriers might be allowing them to, use audio version of their textbook instead of written text because they can't view it, right? Or text-to-speech software so that it can be read to them because it's hard for them because of their visual impairment to read it, right? So that's an accommodation. Accommodations typically don't require a lot of staff time, right? They don't tend to be very heavy on the staff is another way to think of it. There's something that can kind of be provided and maybe with a little bit of help be implemented. For students with ADHD, accommodations can include things like I mentioned, like the reduced homework load, or some other accommodations in the classroom. We'll talk more about some of those, but things like preferential seating, sitting closer up to the teacher. As I mentioned, they're governed under a different legal framework. And to be eligible, students must have a physical or mental impairment that significantly limits one or more major life activities and also impacts their ability to learn at school. The components typically include accommodations, but also occasionally some supports and some intervention services, depending on the intensity, that help the student learn effectively. That says IEPs there, so say 504s are typically developed and monitored by a small team and are adjusted periodically. So the team tends to be much smaller. Maybe sometimes it's even just one key member from the school, and they're adjusted typically once a year, but they're not set on kind of this rigid structure. So looking at this overview, you can kind of see the difference here. Another important piece about the legality of these plans is that they are both governed by these laws, and that the school is legally responsible for implementing the services and supports that are in the IEP and 504 plans. And so parents, rightfully so, like to have these plans in place because they feel like they held the school more accountable, and if something's not happening, then parents have a legal recourse to follow up and kind of insist that things be changed so that the school is following these rules. So the evaluation requirements for an IEP require formal testing as well as a review of academic and medical records. So there's a formal evaluation that typically includes both cognitive testing and achievement testing. For a 504 plan, there's a review of academic and medical records, but formal testing is typically not always required. Sometimes schools will do it anyway. They have a standardized special education evaluation process that they start with at the outset, and so testing is included, but it's not as much required for a 504 plan. As I mentioned, the documentation for an IEP includes goals. It also includes the present level of academic functioning and includes progress monitoring. With a 504 plan, it simply just lists the accommodations and services or supports they may be receiving. And then for eligibility categories, for an IEP, the disability needs to fall underneath one of IDEA's 13 categories. So these categories, I won't list them all, but they include things like specific learning disorders, which include things like dyslexia, speech or language impairment, hearing impairment, autism, etc. What there isn't is a specific category for ADHD. So in those 13 categories, if you look through them, you will not see ADHD. So as a result, ADHD is classified under the 13th category, which is broadly titled Other Health Impaired. And so schools use that Other Health Impaired category to cover ADHD. And it's less kind of objectively defined, that category, than some of the others, which can create some challenges with qualifying for an IEP with ADHD that I'll talk about a little bit later. Let's just briefly talk about some typical accommodations and services or interventions for ADHD so you can get a sense of the kinds of things that might fall under a 504 plan or the kinds of things that might be more appropriate for an IEP. And just also to clarify that an IEP can include accommodations, right? That can be in an IEP. But for a 504 plan, it's typically just limited to accommodations with maybe a few like light touch services included in there. So for common accommodations for ADHD, this is things like extended time on tests, movement breaks being allowed throughout the day in the classroom, using things like visual schedules or checklists that a student may have in their binder or on their desk to help them stay organized and remember everything they need for transitions or for taking things home. Preferential seating, as I mentioned, is when students get a seat that's closer, usually to the teacher, to help them focus better. Use of technology, so if writing is challenging for them, they may be able to use speech-to-text software, for example. They can have an extra set of textbooks or just materials. Maybe if there's a set of worksheets that are being used in the classroom, they can have an extra copy that are kept at home so that they don't need to remember to bring these things home every day to do their homework. So that reason or barrier to doing homework of, well, I forgot all the materials at school, can go away and they can do their homework at home. And then also modified homework assignments. So typically for ADHD, that includes a bit of a reduced homework load, or sometimes breaking down longer assignments into smaller chunks and putting them on like a specific schedule with due dates for some of those smaller pieces, so that for older students have these larger projects, they don't end up not doing anything until 2 days before and then rushing through everything and not doing the work that they're capable of. In terms of services or interventions, this might include individual or small group direct instruction in executive functioning skills, so like organizational and planning skills, for example. A classroom behavior management plan that's pretty intensive and tailored specifically to the student. Social skills groups or individual counseling centers with a school psychologist or school social worker or school counselor. Any additional specialized teacher support during class, and really anything that would fall in the category of like small group instruction pullouts. All right, so the IEP process, it can feel very daunting, I think, and overwhelming to even know where to start or know what to expect with this process. And it's an interesting thing because as a parent, you're really in the driver's seat of getting this process initiated, and you're very much involved throughout the process in that you attend IEP meetings or you're there for a meeting when they're discussing a decision, the school is discussing a decision about whether or not your child should qualify for an IEP. And yet at the same time, you're somebody who's very much outside the system overall. And school websites and things don't always make it crystal clear how parents can go about initiating this process or what that process looks like. So this gives a kind of a broad overview. Different states and different districts may have some nuances that are slightly different from this, but overall, this is typically the flow. So an IEP process typically kicks off with parents submitting a letter to the school requesting an evaluation for special education services. And this letter can be sent to the school principal, or if there's a special education coordinator at the school, you can send it to them as well. An email format is fine. And then from there, the school schedules a meeting to discuss your concerns with you and review any available information that they have in terms of school records or reports or NIMS rating scales that they'll have completed by the teacher. And at the end of that, they determine whether or not your child should have an evaluation. And you're a part of this meeting, you can weigh in on this. And if all goes well, the school agrees to an evaluation. And from there, they'll present you with an assessment plan. They'll let you know what the evaluation will include, and you basically consent to that evaluation based on that assessment plan. Then the school conducts the evaluation within 60 days after parents provide consent. after the evaluation's completed and has been scored and kind of a report is written up based on the findings, the school team and parents all meet to review the evaluation results and then determine whether or not that student is eligible for an IEP based on, is this a disability that impacts their school performance? And if they are eligible, then an IEP meeting is scheduled. And during that meeting, that's where the specific goals are identified, the specific interventions and supports and accommodations that will be used to achieve those goals are laid out, and then the progress metrics, right? So you have a kind of a broad goal, and then at various time points, breaking that down into smaller, more specific gains that you expect to see, kind of benchmarks along the way to determine whether the student's making adequate progress. So if at that evaluation meeting, it's determined that the school says that your child, based on these results, is not eligible for an IEP or for special education services, then if you disagree with that, you have the right to request an independent educational evaluation at the school's expense. So that's where it's an outside evaluation that's paid for by the school. It needs to be comparable in scope to the evaluation that was provided by the school, but it's done by an outside provider. And it's at the school's or public's expense. The school can refuse this, but often they do grant the independent educational evaluation. So that's typically the next step that parents take. But hopefully, the school will consent and you will agree to an IEP or a 504 plan. So as I kind of alluded to, with ADHD, there can be some challenges with qualifying for an IEP. And I think that with many behavioral challenges or even with autism, it can be a bit more challenging to qualify for an IEP than with something more like a specific learning disorder. And the reason for this is that many students with ADHD may be at grade level academically, but they struggle significantly with those areas of executive functioning that we talked about before, with things like organization, attention, or behavior. But the school may argue that the ADHD doesn't significantly impact learning because they are at grade level. Now, just because they argue that doesn't mean that it's correct, but that can be something that they may try to push back on. And one of the things that's challenging with ADHD versus learning disorders is that kind of identifying those academic deficits, it's less standardized with ADHD compared to learning disorders, right? And so with learning disorder, a student may be significantly below grade level, right, in one area. And that really highlights the fact that this is a learning disorder, and our goal is to get this child at grade level, right, in this particular area where they are struggling. It's very clear, it's concrete, and there's a clear academic goal. With ADHD, a student may be performing fine academically, but how is that even defined? Like if a student's getting all B's, but they're struggling just to be able to get that, and they're an extremely bright student, where that should either be coming more easily to them, or maybe for them, that's kind of underachieving, right? It's more, it's less concrete, and it's just kind of more individualized, and it's less black and white really than what you see with typical learning disorders. So you have to really make the case, and the school has to be willing to also make the case and hear the case that for this student, these academic deficits are causing impairment, and that while their grades may look reasonable or even strong, the amount of effort and stress that it's taking for that student to get there is unacceptable, and is where the impact on their academic performance is really kind of more obvious and visible. And as I mentioned before, there isn't a designated IEP category for ADHD, with ADHD falling under other health impaired, which just also kind of makes things more vague and fuzzy without as kind of concrete definitions around what qualifies, where is the disability in terms of the educational component with ADHD. And then also with some schools, what I found is that there can be this misconception that ADHD only requires accommodations and doesn't require any specialized instruction. So in contrast with a learning disorder, there's specialized instruction is clearly needed. If the student's not reading and you keep giving them just the general classroom instruction over and over, they're not making any gains. They clearly need specialized instruction. With ADHD, can be a misconception that, well, we'll just, give them extended time on tests or move them to the front of the classroom or reduce their homework burden a bit, and that will be fine. When really often that's not enough. And actually, there's even some research evidence showing that those accommodations kind of across the board for students with ADHD don't necessarily have that much of a benefit. There's some exceptions to that. For example, students with slow processing speed, benefit from the extended time. But in other cases, it really doesn't benefit them very much. What they do need often are those individualized behavior plans, classroom behavior plans, specific instruction and organizational strategies, and they may need access to an adapted curriculum that really breaks things down into components that are manageable learning chunks for them based on their basically cognitive strengths and weaknesses. So let's look at some case examples to try to put some of this all together and make some of these sort of, all these different pieces a little bit more relatable and understandable. We'll start with Jordan, who's a high-achieving but struggling student. So he's a 10th grade student with ADHD, and he's got very strong verbal skills and maintains mostly A's and B's. So he's one of those students that teachers really enjoy, right? With his strong verbal skills, he's easy to engage. During the classroom, he's really able to participate in discussions. He's interested, and they see him as being very bright, and he mostly maintains A's and B's. But his homework is always late, and he struggles with long-term assignments because he forgets deadlines or he procrastinates, and then the work that he turns in is sloppy, even if it's maybe accurate and kind of well-developed in other ways. His teachers note that he frequently loses materials, turns in incomplete work, and needs constant reminders. And they're frustrated because they see his potential and they don't understand kind of why he can't follow through on things the way that they would expect. But the school also tells his parents that because his grades are fine with mostly A's and B's, he doesn't qualify for an IEP because it's not impacting his academic performance. So ADHD is affecting his academic performance. It's just in other ways, right? Because it's impacting his executive functioning, which affects organization, task initiation, time management. And a student doesn't need failing grades to qualify for an IEP. These executive functioning challenges based on the law are qualifiers for an IEP because it's impacting learning and his ability to follow through on learning using the standard curriculum. It's not affecting just his grades. It's the impact on the whole process. So parents can request an evaluation in writing and then reference the IDEA's requirements for assessing executive functioning. And often that will help kind of redirect the school and help them reconsider whether or not an evaluation would be appropriate. So Maria is a bit younger, but she's a student with behavioral challenges. She's an 8-year-old with ADHD in 3rd grade, and she's impulsive, so she frequently calls out in class and has difficulty staying in her seat. She struggles with transitions and becomes frustrated when she's given multi-step instructions. And her teacher reports that she's disruptive, but she's also very bright and very capable when she's engaged. So again, the teacher feels frustrated because she sees the potential and then it's hard to kind of process why Maria is not able to follow through. So the school suggests that Maria's issues are behavioral rather than academic, and then is hesitant to evaluate her for an IEP. But as with our other case, ADHD-related behaviors here, impulsivity and emotional dysregulation, can warrant an IEP under other health impaired if they interfere with learning and being able to access the curriculum in the classroom, which are clearly challenges for Maria. In her case, supports like structured routines and positive behavior supports or positive behavior plans can really help, and those can all be built into an IEP. And if the school refuses an evaluation, again, parents can request a formal written explanation. You can pursue an independent evaluation on your own, and then bring that to the school also. And then you can also consider whether a 504 plan might meet Maria's needs. So it might be that things like the structured routines and a lighter touch positive behavior plan, and maybe some accommodations around breaking down multi-step instructions into more individual instructions or reducing homework load may really be enough to help her. And there's a lower bar to getting a 504 plan than an IEP with most schools. So pivoting to a 504 plan is a first kind of a trial, see if that really makes the difference that they need, then that might also be a step to consider. And then lastly, we have Ethan, and he's someone who needs more than accommodations. So he's a 7th grader with ADHD who's had a 504 plan since 4th grade. His accommodations include preferential seating, extended time on tests, and movement breaks. But despite these accommodations, his grades have declined. And as demands have kind of increased, he struggles with things like note-taking, writing essays, and completing multi-step assignments. And his parents requested an IEP, but the school argues that a 504 plan should be enough. So since a 504 plan only provides accommodations and some supports, if a student needs direct instruction in executive functioning, writing, organization, even note-taking, an IEP might be necessary. And the specialized instruction can be part of that. Parents can request an independent evaluation to document learning needs and advocate for an IEP. If the independent evaluation, though, is typically, I should say, only paid for by the school if school's already done its own evaluation and you disagree with the results. So if they haven't done an evaluation as part of his initial qualifying for the 504 plan, then really you're still just pushing for the school evaluation, or you need to seek an independent evaluation on your own, and that unfortunately is paid for out of pocket. So let's talk a little bit about advocacy and how to support your child. I think being here right now at this webinar, I think is a great step actually in terms of advocacy and understanding how to support your child. Just increasing your knowledge, understanding that you do have an active role in the process of getting an IEP or a 504 plan for your child. It isn't fully up to the school, and that you do have steps that you can take if you disagree with the school. I think that's just having that knowledge is really important. When it comes to actually meeting with the school, I think being as prepared as possible is always going to benefit you. So bring documentation, bring diagnoses your child has received along the way, any evaluations that have been done, report cards from previous years or teacher reports or rating scales that have been completed. Bring those with you. In advance, in writing, for your own sake, list out your concerns and your observations, and then you have that at the ready during the meeting. Because when you're in the meeting, it can be a bit overwhelming. You're kind of sitting there as the outsider with all of these like experts in the room, and it can be hard to kind of recall everything and have it front and center in your mind when it's not written down in front of you. And then when it comes to reviewing what they're proposing for an IEP in terms of the goals, interventions, and progress monitoring, or a 504 plan in terms of the accommodations and supports, always ask for draft documents in advance so you can review, and then have post-it notes and questions jotted down on there that you can follow up on during the meeting. If you hit roadblocks in this process, if the school refuses to evaluate, you request a prior written notice, which is a written notification of their refusal and their justification for the refusal. So that gives you something to respond to. If the school does an evaluation and you disagree with the results of an evaluation, you have the right to request an independent educational evaluation that, as I mentioned, is conducted by an outside provider, but at the school's expense. And I would recommend not going it alone. You can, to these meetings, these IEP meetings, or to the kind of meetings leading up to the IEP where you're advocating for an evaluation or reevaluation, you can bring an educational advocate, which is somebody that you hire to bring with you if you've hit roadblocks or anticipate that. But just bringing a support person with you, right? Whether it's your partner or a friend or another family member, somebody else just to be there to be a second set of ears and just to take everything in and help you process everything afterwards can be very helpful. And then during these meetings, it's important to remember that the school really is your partner in all of this. And in many cases, I'm talking about what happens here if you hit roadblocks. In many cases, there aren't roadblocks. Like there's many cases where students go in, they get an evaluation, they qualify for an IEP or a 504 plan, and it all makes sense, and everyone's on the same page, and it goes well. And that's the ideal situation, and it does happen. I've seen it happen many times. It's just that these other situations do happen too, and those are the things you sort of need to be prepared for. But during these meetings, you are partners. So the way that you talk to the school during these meetings does matter, and it can really influence how willing the school is to collaborate with you. So if you feel like you disagree with their decision, you can ask them questions like, can you please explain the data that you're using to make that decision? You know, my interpretation is different, but it would be helpful for me to understand how you got to this answer so that I can look at that data and understand your interpretation, right? And when you're disagreeing with them, it's always helpful to first, say things like, well, I understand your perspective, or I can see where you're coming from. Here's what I'm seeing at home, or here's what it looks like when my child is trying to do this homework that comes home, and we work through it and they're able to turn in this assignment, but this is what the process looks like. And I realize you might not be seeing that at school. So let me give you some additional context here. But it's really kind of about more kind of collaborative back and forth conversation. The more you can steer it in that direction, the better off you will be throughout this process and the better outcome you'll have for your child. So just some final recommendations here and resources. So just key takeaways. IEPs and 504 plans can be used to help your child get the help they need to succeed at school. And students with ADHD can qualify for these services. And sometimes this happens pretty easily, but other times strong advocacy might be needed on your part. But knowing the differences between IEPs and 504 plans, understanding the process, and coming to meetings as prepared as you possibly can will just help make you a stronger advocate for your child. And some helpful resources that can kind of help you get there. These are just some great websites that have a lot of information on them that's accurate and useful. So understood.org, rightslaw.com, and CHAD, that's Children and Adults with ADHD organization. And also your state's Parent Training and Information Center and Department of Education website can also be useful resources to learn a lot more about the specific nuances of the overall special education IEP process in your district. All right, well, thank you all for your time and attention today, and I'm happy to answer any questions that you all may have.
Excellent. Thank you so much, Dr. Rooney. You got lots of comments saying this is great information. And I think we're going to get a lot of questions that we're not going to have time to answer, but we're going to make sure that Dr. Rooney gets all the questions and can follow up with you if necessary. So let's dive in. So a few people, Dr. Rooney, were wondering about the process in terms of, if I request the IEP and the evaluation and the school says no, what else can I do, right? Is there another step that can be taken, or does the road kind of end there? So I think people were concerned about that. and just sort of wondering what else could be done, if anything.
Yeah, so if the school refuses to evaluate, you request a prior written notice which describes why they are refusing to evaluate. You can respond to that with a broader with your justification for why you think they should still be evaluated. So if their argument, often the argument is around kind of what I mentioned, where they say that this isn't impacting their educational performance. So then your best bet is to point to the fact that deficits in executive functioning constitute a reason for evaluation based on the IDEA statute. So pointing to that can at least get them to reconsider whether or not an evaluation should be done. You can at this stage also hire, if you really want to kind of go to the next level, an educational advocate or an educational attorney. Another option is to get your own evaluation done privately, which for those of you that have looked into this will know that it's quite expensive. I mean, it can cost thousands of dollars to get this done. But what I would encourage you to do is look into there's alternative ways of getting the evaluation. So if you have a university in your town or within, I would say, like an hour or two's drive that has an ADHD program, graduate program, or even like their Department of Education program, they will often do evaluations for the public at a reduced rate or a sliding scale. And sometimes it can be a few $100s versus a few $1,000, and you'll get a high quality evaluation. There's also certain medical centers will accept insurance to pay for evaluations, and certain larger private practices even will accept health insurance to cover the cost of an evaluation. So if you do some searching, and you may need to go outside of your immediate area, and sometimes even from where I am, just outside of DC, we'll have people that will drive up to Pennsylvania 2 hours away because there's some place up there where they can get an evaluation that's covered by insurance. So you only have to go a couple of times to this appointment, and sometimes it's worth it just to make that drive and get it covered by insurance. So I think don't let the cost barrier deter you completely. I think if you do some legwork, often you can find some more reasonable options for getting that independent evaluation. And then you can bring those results to the school, so they didn't need to do their own evaluation, but yeah, you have those results, and now they base their decision around an IEP or 504 on the results of the evaluation that you have provided. And then that can be a really strong path forward.
Excellent. So let's do one more question, then I'll just ask you for a couple of key takeaways, because there's certainly a lot of information for people to process. But let's do one more question. And one comment I wanted to make, you were touching on the collaborative aspect of these kinds of meetings. Sometimes if you do run into a roadblock, ask them what they need to see, and that sort of brings the next question, which is, what do you need to include in a letter for an IEP or a request for an IEP? Are there a couple of key ingredients that are just more compelling than others? What would you recommend, I guess?
Yeah. So in that letter, you want to include if your child's been diagnosed with ADHD, you want to include that they have this diagnosis and that they've been diagnosed by a medical professional. And you want to describe the challenges that they're having that are impacting their ability to learn in the classroom. And that may be executive functioning deficits, behavioral challenges, other ways that ADHD may be impacting their ability to learn, and some of the ways that these impairments are showing up, and that you think that your child would benefit from special education services at the school, and you would like to request an evaluation for those services.
Excellent. So let's do a couple of key takeaways, and then we'll close things out for today. As far as we covered a lot of ground, are there a couple of key things that you want parents to think about as they go through this process, or are already in the process and just trying to navigate things as they go forward?
Yeah, I think the main things to the main takeaways are that, initially this process can seem overwhelming, and that's normal. Like, everybody finds this process overwhelming at first, but the more that you learn about it, the more that you understand, based on information that you can find online from your school or in talking to your special education point person at the school about what the process is, the more comfortable you'll feel. And once you get into the process, it kind of starts to unfold and you start to understand it better as you go. I think that if you can find even just one person at the school who you kind of feel like is somebody you can go to just to ask for advice, or somebody who can kind of be your point person throughout this to just sort of ask for clarification, and somebody that you just really feel is really supportive of you going through this process, I think if you can find that person, don't hesitate to reach out to them and just ask questions along the way. Nobody expects you to know everything coming into this, because this isn't something you do every day. It is something they do every day. So don't be afraid to kind of collaborate with them, even in that informal way, and partner with them early on, kind of regardless of whatever the outcome is, or the path forward that you're taking. And I would just also say, if you do hit roadblocks along the way, don't get discouraged. There are ways to get past them, and I think, but it does take a lot of persistence and sometimes creative thinking on your part. So, yeah.
Yes, be a strong advocate. Stay in there, hang in there.
Exactly.
It is a lot of fun. Parent of a student with an IEP, I totally relate to the challenge. Yeah. It can be exhausting, but at the end of the day, it's such an important step to help your child ultimately. So, Dr. Rooney.
Exactly, and it's hugely rewarding at the end of it. Yeah.
Oh, absolutely. Yeah. Dr. Rooney, thank you so much. I know there are quite a few questions that we didn't get to. We'll make sure Dr. Rooney gets copies of all of those to follow up. And as I mentioned before, we stick with this as we close out the event, because there will be another survey. It's just 2 questions. One is to rate the event on a 1 through 5 scale, but I think the key question is, what are the academic challenges that your child is experiencing, just so that we can make sure that you're getting the notifications and the appropriate information on the services that are most relevant to your needs. That's really important to us at Huntington. So, Dr. Rooney, I want to say thank you for your time, and for everyone who's joined on behalf of Huntington Learning Center. Dr. Rooney, thank you so much for making time with us. We'll make this webinar available to you within the next couple of days, and we look forward to seeing you at the next event. Thank you so much.